Okay, welcome. First of all, thank you to everyone that's registered and participating in this webinar. Thank you to those that participated in November's webinar and are back again today, as well as we saw a number of new contacts where this is their first ClearScript webinar, so we thank you as well. I'm Kyle Johnson, Vice President of ClearScript. I'll be the moderator today. I am pleased to have joining me Mr. Tim Affeldt from Fairview Pharmacy Services as our guest presenter, subject matter expert as it relates to specialty pharmacy, specifically for health plan success. So a lot of folks today here are brokers and consultants. We also have some folks that are from employers and third-party administrators, as well as pharmaceutical industry and other health systems. So welcome to everybody, and we'll kick this off. Once Tim's presentation is concluded, we'll have a question and answer. Once again, preparing for follow-up webinar later this summer. So we'll think of topics that are important to participants today, as well as we'll have a survey that's sent out because we'd like to get people's feedback, and also would open up the opportunity to, if there are questions that need to be answered regarding today's webinar, we'll set up some other smaller group sessions, or I can just call and discuss and answer any questions that you might have. And then lastly, we are going to record this live event. So if anybody wants it, I know people have already asked for it as they're at conferences currently. We'll have that available as well. So the agenda is as such. Welcome by ClearScript, understanding specialty pharmacy, question answers, and what's next. We're going to try to get through this to leave ourselves with around 15 to 10 minutes to answer questions and follow up. Next slide, please. All right, so just a little bit about ClearScript, because there are some new folks attending this webinar where ClearScript might be a little new to them. ClearScript, as a pharmacy benefit manager, we process pharmacy claims primarily for self-funded benefit plans. We are the intermediary between the benefit plan and the pharmacy, and manage the pharmacy component of the benefit plans for predominantly self-funded employers. ClearScript was founded in 2005, so 18 years. We were founded as a business unit of Fairview Pharmacy Services within Fairview Health System. So we are part of a nonprofit health system, one of only a couple of PBMs in the country that can claim that. So we have a different, vastly different perspective on pharmacy benefits. We bring a health system perspective. We are a nationwide TPA with national TPA and PBM licensure. We are partnered with Fairview Specialty Pharmacy and Mail, which fills prescriptions for members in all 50 states. We also bring a national retail network. So where we have folks in other states where we don't, as Fairview, don't have pharmacies, we do work with, or we do have a national network with all major chains, and most independents, about around 62,000 large is our network size. Who we serve are third-party administrators on the medical side, TPAs. We service a number of healthcare facilities, whether that's critical access hospitals, safety net providers, all the way up to large IDNs, disproportionate share facilities within health systems. We also service a number of tribal nations, so tribal governments, their benefit plans, as well as their enterprises, so their casino and gaming and other enterprises that tribal nations have. We work with brokers and consultants nationally. We're heavy in the public sector, large school district book of business. And then primarily self-funded benefit plans is who we serve. Next slide, please. Best-in-class mail service and specialty pharmacy partner. That's who's going to speak today is Tim. Excuse me. Very responsive, consultative account services. So we really promote a lot of hand-holding and take that consultative approach to our clients, whether those are broker and consultants and or their clients as benefit plans. We very much have aligned interests, being part of a nonprofit health system and aggressively servicing organizations that are typically underprivileged or underserved at a fair, reasonable, and transparent price. Very much aligns us with self-funded benefit plans, which are, for all intents and purposes, insurance companies, or one could say they're insurance companies. So very much aligned. Member-centric services and wellness initiatives. Once again, that health system perspective brings that to the forefront. Analytics and actionable data. So we don't believe in just sending out data, sending out group reports. Our goal is to also consult on that data and help our customers and clients make informed decisions that can positively impact their benefit plan, but also member health and positive outcomes. And then performance proven results. We year in and year out aggressively outperform the big 3 PBMs and most of the other smaller PBMs as well, from both a cost per script metric, unit cost, as well as trend year over year. Next slide, please. All right, understanding specialty. So I'm going to turn this over to Tim Affeldt. Tim Affeldt, PharmD, a doctor of pharmacy, is Vice President of Specialty and Infusion Pharmacy Operations within Fairview Pharmacy Services and Fairview Health System. Prior to that, Tim was the VP of Specialty Infusion Operations for 9 years, with Fairview Pharmacy Services. Prior to that, 19 years with Walgreens, led the implementation of specialty, MTM, or medication therapy management, as well as diabetes programs. He is a University of Minnesota College of Pharmacy graduate. Currently, he's on the East Coast speaking at a large conference, so we're very fortunate to have him here. He's highly sought after as a lecturer and presenter, but he has board positions, including but not limited to Pharmacy Alumni Society, Minnesota chapter of American Diabetes Association, Juvenile Diabetes Research Foundation, Minnesota Pharmacists Association, National Association of Specialty Pharmacy and Health System-owned Specialty Pharmacy Alliance, and the National Home Infusion Association. So we're very fortunate to have him present today. And with that, I'm going to turn it over to Tim.
Great. Thank you, Kyle. I really appreciate that introduction. So happy to be with everyone today, and certainly going to run through kind of our history of specialty here at Fairview. And then we will move into just talking about specialty pharmacy. So next slide. So if you think about our Fairview history, again, started out as a health system, I guess now more than 115 years ago. And you can see kind of our mission really is to, make people healthier, and our vision and values are on there. And then kind of significance to this discussion today is really when Fairview started to partner with the University of Minnesota in 1997. And then over the last 25 years, a number of organizations have gotten together to basically create the brand M Health Fairview as it exists today. The 1997 is kind of significant too, because that's really when you started to think about specialty pharmacy starting to take off over the last 25 years. Next slide. just a little bit more about pharmacy services. And for us, what we believe and we have is you really need to have a comprehensive pharmacy services to take care of any of the pharmacy needs of your health system. So on the left there, you can really see all of the different pharmacies and services we have for our patients and consumers. We're in basically every type of ambulatory pharmacy there is except for nuclear pharmacy. And then on the right, we have a lot of different solutions for employers and health systems and plans. And you can see some of our most recent statistics. We're roughly about 1,800 employees just within pharmacy services. We take care of about almost 2.4 million prescriptions last year. And we are starting to approach that 2 billion in top line revenue just within pharmacy services. Next slide. And then we can jump to the next one too. So really we'll start to talk about our specialty pharmacy, and some of these things will be interwoven throughout my slides, but these are some of the kind of table stakes it takes to even enter the specialty pharmacy arena. So basically you need to have that 24-hour support of pharmacists and technicians. You need to have kind of robust patient educational services and pharmacists that are following up with patients. You obviously have to build out your call center support, not only for taking and dealing with patients, but also then with following up in terms of adherence and all of the different things that go on with a call center. You have to have accreditation, and really URAC accreditation is the kind of the gold standard of accreditation within specialty pharmacy. There are a number of different accreditations that are available at this time. Next, you look in terms of relationships, and I'll talk about this a little bit more in terms of providers, payers, and pharmas. And then you get into kind of your data and analytics capabilities. And I will also talk quite a bit about shipping and cold chain that kind of go hand in hand, and you need to have that type of capabilities. That's certainly something that is much different than kind of your retail pharmacy perspective. Then you get into contract billing, reimbursement, dealing with payers, along with just integration with care team, which I will talk about quite a bit too, just in terms of thinking about a specialty pharmacy and how you interact with the care team, how you interact with the provider, and really why we think this model of a specialty pharmacy within a health system is the preferred model, and I'll certainly talk to that today. So next slide. A little bit more just our demographics. We do have more than 200 employees working on specialty. 40 of them are pharmacists. Another 110 kind of pharmacy technicians just within the pharmacy, and then quite a few other employees, both pharmacists and technicians, that get involved more from a clinic and integrated with the clinic perspective. We run off the Enterprise RX dispensing system that comes from McKesson. Our kind of care management or clinical management software is Theurgy. And we also, it's kind of vitally important these days that you can interact and communicate with patients in any avenue that those patients want. So we do have some texting functionality, both mScripts and Fairview Link, to interact with our patients. Next slide. So just a little bit, we do, like Kyle mentioned earlier, we're in all 50 states, so we're shipping out packages and taking care of patients from just about any corner of the United States. We basically have access to all limited distribution drugs other than a few that we're still chasing. We take care of more than 12,000 patients on any given day for their specialty medications. And we do take care of more than 15,000 specialty prescriptions every month. Next slide. The next, just some of the things kind of maybe we believe is specific to us. And when you think about as a health plan, PBM in terms of, you know, how do you have success in specialty pharmacy? It really is about who's your partner in specialty pharmacy. So see, these are some of the things that we do that you don't necessarily know that every specialty pharmacy does. So one is you want to answer all your calls live and immediately interact with that patient. You know, don't have any type of call tree. These are patients that have a lot going on in their lives, a lot going on with having a new diagnosis many times, and getting them immediately connected with the right people within your pharmacy kind of starts the process. You'll see this reflected later when we talk a little bit about customer satisfaction, which is a big part of specialty pharmacy. You know, you really do need kind of have that full spectrum of care continuum and basically having a glimpse into that patient's total health care and interacting with their providers and interacting with their clinic teams. That certainly leads to better adherence rates, and better in terms of amendment rates. And then we certainly get patients on to service much quicker. And, you know, we have some pretty impressive time to fill metrics. And then we do build care management very specifically. We try to treat it, you know, patient by patient. We try not to kind of peanut butter spread how you do care management with a group of patients. We really try to dive into each individual patient and make sure we're setting them up for success. Next slide. So again, our Net Promoter Score, kind of industry standard. You know, I would recommend a friend or family. Again, we're at 87. We've averaged pretty much over 80 for much of the last 6+ quarters. Again, and we always obviously compare ourselves to some of the other specialty pharmacies in our market or that we compete with when it comes to when plans and PBMs take a look at who do they want to be their partner for specialty pharmacy. So next slide. Just a few numbers I'll throw out there that I think are of significance. Not only the Net Promoter Score, but if you think about cost savings, something all of you are very interested in. You know, we did do some things with our pharmacokinetics testing and program within hemophilia and saved one of the plans more than 2.4 million. We do a lot in terms of when we have our pharmacists integrated with our providers and our clinics to reduce side effects, mitigate side effects, and keep patients on their medications. And that's certainly the case within oral oncology. We've done a lot within rheumatoid arthritis, obviously, you know, anything inflammatory related being one of your biggest drivers of spend, showing really an 80% therapy success within that category. You know, there are studies out there now, and I did put one on here showing that, you know, if you take a look at kind of these health system specialty pharmacies, they are starting to show the lowering of the total cost of care. And we do quite a bit of waste management programs with our payer partners. And one of our plans last year, we were able to save them 1.2 million in waste management strategies within specialty pharmacy. So next slide. So just a little bit on the history here. I won't dwell on this, but to kind of set the stage for all of you. You know, most folks think specialty really came up in the last 10 years. But it's actually been around for basically 50 years. Obviously was pretty modest and small in nature for many years. That Orphan Drug Act of 1984 is really what kind of created some benefits for pharma to spend more money and move money. And now I think, you know, you can debate whether all of their money has been moved into developing these specialty therapeutics. But that's really when it started to take off. And then you can go to the next slide. It really did take pharma a good solid 10 years to get going and ramp up. By the mid-90s, you had roughly 30 specialty drugs, and then 10 years later, in the mid-2000s, you had more than 200 drugs available. So, and it certainly has continued to take off from there. Really kind of when it moved from kind of that local retail, hybrid retail, patients were still picking up a lot of their own meds, really went on until the late 90s. CVS really kind of had the first launch of what we now consider these national specialty pharmacies. So that really did launch about 23, 24 years ago. And then obviously, I think everyone's well aware how the revenue has grown. I just put a few numbers in there. Obviously, the big spike has come in the last 10 years. So next slide. So just kind of level set of what a specialty drug is. I think most folks now know. I mean, there's a lot of different disease states. There is no universal drug list. Every payer basically has their own specialty drug list. There's lots of debate on that now. There's even some debate on kind of a category of specialty light when you get into HIV, transplant, diabetes, certainly discussion on those categories today. But in general, they're higher cost drugs. They're drugs that often require kind of special management or storage or cold chain shipment. Often you definitely need a higher level of kind of follow-up and care management and collecting data with these patients. Certainly a more intensive in terms of trying to keep them on their specialty drug. That kind of is, so the very kind of ambiguous definition of what a specialty drug is, but in general, there are a few things that do kind of make up that specialty drug. Next slide. Now we kind of get to the current state, really, and I think most know, over the last 10 years, I'd say the PBM-owned specialty pharmacies really dominated by just a few players. Primarily through consolidation over the last 10 years. And you basically have those groups filling about 2 out of every 3 specialty prescriptions in the US right now. The fastest growing segment has certainly been the specialty pharmacies owned by a health system like here at Fairview. And certainly that will continue to grow. I believe the last stat I showed was of any health system with at least 600 beds, about 80% of those had some sort of internal specialty pharmacy capabilities. So next slide. So next, I'm just going to kind of current state, what specialty pharmacy should be doing and what you would want to expect, again, as you look for your partner in specialty pharmacy. Certainly, you need that prescriber connectivity. That's certainly something we do. We have liaisons, both technicians and pharmacists within our clinics integrated with that care team. It certainly helps that care team make decisions when it comes to specialty care. It helps them understand farther upstream in terms of, kind of what would be the utilization management going on for that patient from their payer perspective. And have that provider have a much better understanding of that farther upstream. You certainly have that EMR connectivity so that you can communicate and follow up with a provider. You can give them information that you get from your pharmacy services and when you're interacting. And again, we have pharmacists talking to these patients far more than a clinic or a provider is talking to these patients. And then making sure all of that information is getting back to the provider so that collaborative approach to care, and if something needs to change, can be done, and it can be done quickly. Compliance reports and adherence reports, we do share that and get that in the hands of physicians. We certainly debate and strategize when you get some of those more difficult patients where that maybe have a lot going on in their lives We can tap into social workers and many different resources that we have within our health system to try to help get that patient back on track if they are having an issue with adherence. And certainly all of our therapy management clinical updates can then be communicated back through that EMR. So next slide. Payer relationships. Again, we take a very consultative and collaborative approach. We meet with a lot of our payers. We're engaged. We try to strategize with them. We have a lot of quarterly business reviews, a lot of monthly kind of strategy. What's coming next? A lot of times we're looking at pipeline. A lot of times we bring in our subject matter experts from our service lines to meet with the payer. That's become something that is very common, and certainly I think something you get when you have access to a health system that you are partnering with when it comes to specialty pharmacy. Next slide. So again, you definitely need a strong relationship and reporting relationship with your manufacturers. And for years, this is the category where a lot of folks just weren't sure what health systems were capable of, but certainly we've figured it out. We are fully integrated now, often are able to pull data even out of our EMR, which is something that, say, pharma has long been looking for, and health systems can be a little of a bit of a black box when it comes to pharma and getting data. So certainly we've been prioritizing that and developing our capabilities over the last 10 plus years. And we do provide really any type of data that is needed, if appropriate, and it is really done daily. That is something that many health systems have those capabilities. We certainly partner with a lot of the data aggregators listed there. So pretty much anything where a pharma could be wanting to get their data from, we are able to do that. Next slide. Another kind of thing you have to have and very robust is really just that, how are you dealing with the financial toxicity of specialty medications when it comes to patients? It's obviously the largest barrier when it comes to patients. Even if a patient or a family is signed up for a large deductible plan, like many of them do, they're still not quite prepared, especially for a new diagnosis and maybe what those drug costs are going to look like. So we really try to assign every patient kind of basically has their own personal patient financial advocate that goes on within our pharmacy. And that's who they deal with directly. They don't go through the phone tree or anything. They just deal with their own kind of personal financial, navigator or advocate. Our folks really get put into a therapeutic area, so they become very good at the drugs that they have, and they become very good in terms of dealing with the payers that we deal with, which often allows us to speed up that start to therapy, because we just know the nuances of each payer when it comes to their specific therapy and drugs, and that certainly has helped many of our patients. They do all that benefit investigation, prior auth. They dive into all of the different PAP programs and financial programs that might be out there for patients to help with their burden related to their out-of-pocket. Next slide. So again, kind of current state, certainly wouldn't be remiss if I didn't bring up specialty infusion. I'm actually at a big infusion conference right now where specialty infusion is the talk of the conference. Doesn't flow that much into the PBM world, but certainly all health plans and folks thinking about spend are obviously thinking about specialty infusion. This is actually where you have a lot of your newer, more orphan, rare disease drugs coming. A lot of them IV, a lot of them very expensive. Usually specialty is maybe $5,000 to $10,000 a month. These drugs obviously push way over that in many cases. So I certainly listed a few of them. Remicade, you know, one of the biggest drugs in the world for many years, obviously has had some biosimilars enter that space now, which certainly helps with spend when it comes to Remicade. So certainly, as you guys think about it from a planet perspective, you have to be thinking about the whole ecosystem of specialty. Next slide. So again, why especially important? You know, because it's been really growing the last 10 plus years. You know, I put a couple of graphics up there now. You know, it's literally like 1 to 2% of patients on drugs, but it really has finally tipped over that 50% mark. I think it's pretty well established now as numbers start to come out for 2022. And I think I have a graph coming up just to show this a little bit more clear. But we really are now in almost all plans, almost all PBMs now, their spend on specialty drugs has now gone over the 50% mark, definitely during 2022. So next slide. So I thought I'd throw this in there, kind of an interesting slide. Think about biosimilars and how well they're going to be adopted. This is just a 2022 kind of on the bottom and a 2020 or a 2020 versus 2022. And you're definitely seeing that providers absolutely know what biosimilars are. And then they're absolutely getting more comfortable with using biosimilars. So when you think about it from a health plan perspective or a PBM perspective, and you know, what kind of pushback are you going to get from the providers? I would say that that pushback is becoming definitely less and less as we continue to educate, as providers continue to get more comfortable with biosimilars. So next slide. So again, here's that spend graph, kind of the best one I could find. You know, there's really not a graph out yet for 2022. But you really, in 2022, obviously, I think the total drug market is going to go over 600 billion. And I do believe in almost all cases with plans, they're going to be in that low 50%, anywhere from 50, maybe 55, maybe a little bit higher. That is going to be your drug spend now when it comes to specialty drugs. And it really isn't ever going to trend back in the other direction. So next slide. So I think for the next few minutes here, I'm going to get in and kind of wrap up just on some of my thoughts about the future of specialty pharmacy, kind of where's all it's going, or at least some of it going, as best you can predict. But again, these are some of those critical success factors that a specialty pharmacy like ours has. And certainly when you think about kind of your partner in helping manage your trend, you know, these should absolutely be the expectations you have for your specialty pharmacy. In my opinion, you know, that you need to have that great payer, provider, pharma, patient relationships as a specialty pharmacy. That's going to become even more in the future. It's going to become even more as patients get more and more savvy about their own healthcare and their own healthcare costs. Certainly having dynamic ways to interact and collect information from patients is going to continue to ramp up. You know, certainly we believe the future is the health system-based model. You are starting to see that in the marketplace. You are starting to see some of the larger PBMs that have tried to push everything to their specialty pharmacy. They are starting to create health system networks. They obviously still need to do the right thing for their clients in terms of spend. So the belief that you're going to, you know, continue to lock health systems out, you are starting to see folks think this isn't going away. This isn't kind of a fad. So how do we work with health systems, and how do we carve in their specialty pharmacy and make it be a benefit for everyone? You certainly need to have the liaisons and the outreach, you know, within the clinics and embedded, and that includes that EMR access and care integration. You know, even the nationals think a lot about that. and think a lot about kind of EMR integration and how they can better work with the providers that they're dealing with. You need to manage all therapies. You know, there's lots of folks that got into the specialty pharmacy game the last, 10 years. I think I even saw lately there's like 600 URAC accredited specialty pharmacies, which, how many of them are actually kind of comprehensive specialty pharmacies? It's probably about 1/3 of those 600. You need to have a lot of IT and data analytic capabilities as a specialty pharmacy, and certainly you should expect that as a payer. Very robust therapy management that can really pivot and have a toolbox specific to individual patients. And the key is to treat individually. Don't just try to treat everybody the same. You got to be thinking about health inequities. We think about that every day. What are the folks that have a hard time using our pharmacy, and why is that? And then what are we doing about that? And it's our jobs to make sure that everyone has equal access to care. That all has to kind of be blended into your therapy management program. Certainly, those patient assistance programs and being able to have a robust team that can really look into everything and be that advocate for patients is huge, and certainly something our team does. And then really, you can't just be pharmacists in my field anymore. You have to have a business acumen to be in this business. So next slide. So again, if you think about the future, you're certainly going to see a lot of expansion in inflammatory and oncology, and those are pretty much the two big trend drivers within specialty pharmacy. And then those orphan conditions, I think, are going to continue to really grow, and that's where you can really see some, what I consider a little bit crazy when it comes to pricing on drugs. You certainly have the availability of generics and biosimilars, which are going to help with trends and going to help with what specialty drugs cost. And we're certainly seeing some of that. And obviously with the Humira biosimilars this year, first one's on the market, many more coming by summer and fall. That obviously is going to be able to help with trend. A lot of expansion and development in gene and cell therapies. I'll touch a little bit more on that in the next few slides. And then multiple options, which again, I think helps with spend. You take a disease category like SMA, and you had Zolgensma, like a $2 million price tag, but then came Spinraza, and then came Arivzi. So again, you kind of the interesting thing, it used to be there's no drug for my condition, my rare disease orphan condition literally doesn't have a therapy that can help me. Now we got one, and now you're starting to see multiple options in some of these areas, which certainly will help when it comes to trend. And then you're going to really have to think about new novel therapies. Probably the big category out there that everyone wonders about is Alzheimer's, but you do have things like NASH. There's always kind of that what's next, what's the big thing, and most folks didn't predict hepatitis C correctly. I know I've talked to many of my friends from pharmacy that went into the health plans, and in a way, Hep C caught a lot of folks off guard. And folks are trying to make sure that doesn't happen again. So what are those therapies that are coming that could be that unexpected kind of bump in specialty? So next slide. So again, I just kind of put this on there for at least this year and the next few years. Some of the therapies, obviously there's going to be gene and cell therapies every year. The purple on there is kind of your biosimilar market. The blue on there is your generic market. So you certainly have kind of new therapies, new cell therapies, whatnot, that obviously will push the trend up. But then you certainly have some things now with generics and biosimilars that can certainly help with trend, and that should continue now. You're always going to have more biosimilars and more generics coming to market. There's a fair amount of patents running out over the next 10 years. And that's really kind of what we're looking at and evaluating. So next slide. So gene and cell therapy certainly has a plan. This doesn't touch PBM obviously too much, but as a plan, how are these going to get paid for, and what unique models are out there? And this is something we even look at a health system, because we're not sure we want to buy a drug that costs this much. It's not the easiest thing for a health system to float that kind of money for 90 days until we get paid, if we get paid within 90 days. So that's a big question. How do they get paid for? You think about a self-insured member, and somehow they get these diseases. A lot of times are all genetic, or a lot of them are. And what if something comes up and you have 2-3 beneficiaries within a self-insured plan? You can obviously think about what that can do. And then how do you track these patients, or who's tracking these patients? You supposedly have a therapy that cured you, but what if it didn't? Well, what does that look like 10 years from now? And then where are you 10 years from now? And who tracked you 10 years from now? Because you're not taking a drug anymore. You're not being followed like with the classic kind of therapy management that is very robust and goes on within specialty pharmacy, and folks are tracking you, following up with you. With some of these patients, they really are going to be lost to follow-up. So that's something we're thinking a lot about right now is, what is our clinical programs? What is a therapy management program for someone that's been treated with cell or gene therapy? And then really, like employers and plans, like, how do you go about being made whole if the therapy didn't work? And that's a great question, because it could be the patient isn't even your patient anymore, but you're the one that paid for a therapy that ended up not working, or ended up not working forever. So a lot of this is being discussed. Certainly, if a patient were just to be on the same insurance their whole life, this makes it a little bit simpler. But certainly something I see being discussed all the time when it comes to cell and gene therapies. The next slide. And I think this is my closing slide too. It's just, maybe it's just because it's top of mind as I sit here and listen about infused therapies the last 3 days, but certainly that specialty infusion market has to be into everyone's considerations and thoughts. A lot of those chronic therapies are here and growing. Certainly oncology is just absolutely kind of boomed now. And really no signs that that's going to change. And you really need to think also about kind of your infusion strategy, from like, where are folks going to be infused with all of these medications, and shifts in site of care. And that starts to factor into your spend when you think about it from a plan perspective. And there really isn't enough chairs in the United States to take care of the patients that need to be taken care of. So how do you make sure that that home infusion perspective is factored within your strategy when it comes to infusion? And that can get interesting also, because that can then end up in the PBM world. We've seen folks running their spend on specialty infusion through home infusion on the PBM. So a lot of very interesting kind of strategies and thoughts right now when it comes to spend and infused specialty medications. So I believe that was my last slide, Kyle.
Well, Tim, thank you for taking time to spend with us today. Apologize to all of the attendees if you were on another Teams meeting link. I do apologize for that. Obviously, we're learning and growing and acclimating to the virtual webinar world. So appreciate your patience as we grow and develop this. But Tim, you have spent a lot of time with us today, taking time out of your schedule at another conference, national conference where you're presenting. So we appreciate that. We'll send this live recording out to everybody. As as additional questions come up, please feel free to reach out to me with those questions, and we can set up additional conversations and or discussions with Tim or folks from Fairview Specialty. We are going to set up a third webinar here starting this summer, late summer, early fall. So we'll also be reaching out with ideas, what folks would like to hear in terms of next topics, and a Google survey will be coming out. So appreciate everybody's time today. Once again, apologize for any technical difficulties, and I give you a round of applause, Tim. You did a great job. And as always, enjoy working with you and appreciate your expertise.
Thank you. Thank you for having me.
You
Everyone
bet.
have a great day.
All right. Have a good day, everyone.